Now, an important study has been published by Professor Dheeraj Sharma, Dr. Amol Singh and Dr. Abhay Pant of IIM, Indian Institute of Management, Rohtak, on the spread of COVID-19 in India. The paper is titled Predicting Coronavirus Cases in India, Pre and Post Tablighi Jamaat. And I quote from the paper the introductory lines. Coronavirus is the biggest challenge, the paper says, that the world is facing in the recent times. While the government and policymakers are looking for a solution to this gigantic problem, there are some immediate challenges that need to be addressed. One of the challenges is to address the spike in number of coronavirus cases. The number of coronavirus cases have grown drastically, more than 4 times. From 29th of March 2020, it says 902 cases then, to 5th of April 2020, when it rose to 3,843. One of the primary reasons for such a spike is the spread of the post-New Delhi meet of Tablighi Jamaat, which is Asia's supposedly biggest religious congregation. And to talk about this aspect of the spread of coronavirus, we have with us in the studio Director IIM Rohtak, Professor Dheeraj Sharma, also the writer of the paper. Welcome, sir, to our studios. Now, before we talk about the core issue focus of your paper, we just heard the Health Ministry press conference. How do you see the position of India as far as number of cases is concerned? About 5,095 active cases as compared to the world, 15 lakh cases overall. Where do you think India is positioned as of now as far as dealing with COVID-19 is concerned?
I think just to put things in perspective, we are about 1.35 billion.
That's right.
And Italy is about 80 million. And which means Italy supposedly is about 15 times smaller than us.
Right.
US is about 4 times smaller than us. Given all these challenges and given the stage of development we're in, and also in terms of stage of development, we're handling the situation in a very, very professional and very, very robust manner. And I think particularly the credit must go a lot to the district administration, to doctors and the policy makers and our Prime Minister, who's been really continuously taking some very strong decisions and making course corrections wherever the course correction needs to be done. And we can see that the cases really still haven't sort of been alarming to that extent. We have great number of, I would say, the cases have quadrupled. But if you see in large scheme of things, even this catastrophic event, which has happened with this major event, which we studied as an event.
And coming to that, in fact, you locate the Tablighi Jamaat event and the responsibility that was placed on Tablighi Jamaat for the spread that happened and the spike in the cases that happened. If you could simplify your analysis about the kind of contribution that the Tablighi Jamaat event and the members had in the spread of coronavirus. You mentioned in the introduction that it became 4 times in a short period of time. Your analysis.
You see, we analyzed it. We used a statistical model, and we used multiple functions and exponential functions to assess a trend which would come out of this particular event. Now, if I were to simplify, because the contact tracing of these individuals probably had not completed for really a long period of time in between, it resulted in spread of the virus. Now, it is anticipated when one person comes in contact with this particular disease, the number of people who can potentially be infected averages anywhere between 300 to 400.
That's right.
Which is sort of has been verified by a couple of other studies also. We took that into account.
Right.
And therefore, the rise in cases would have probably been much lower if this event had not taken place and if the contact tracing had been successful.
What possible figure are we looking at, sir? Because about 5,095 active cases is what it's...
I think the cases would have been around maybe 2,000 or maybe around that number.
Less than half.
No, 1/3.
1/3.
So it is the concomitant influence of all of this, that you have this infection, large number of people, they spread all over the country. They were unable to be tracked, quarantined. And quarantining people, I mean, you can see there are occasions. Just now we're getting news where in one single family somewhere in the Middle East, there are hundreds of people getting affected. So that all adds up, and it becomes a significant challenge for us now to do contact. It is extremely difficult to do contact tracing.
There's also, we noticed a resistance among the members who participated in getting quarantined or getting approached by the doctor. So that sort of a resistance to identify yourself makes the whole situation even more risky.
I think it does. See, government has started a very good initiative, the Arogya Setu app, which I believe, using the Bluetooth and having the app downloaded can reduce this problem going forward substantially. But as it comes, as the situation now, I think because probably ignorance and probably unawareness of the magnitude of the problem and people's general perception of being quarantined, that fear perception, I think that probably results in people not coming forward in this situation. There's so many people who do not wish to be quarantined, and the similar situation of the Tablighi Jamaat. Even in Pakistan, you would have noticed that there was a gathering in major city in Lahore, and the spread is there. People do not wish to be. I think as responsible citizens, the government can only do so much. Local administration can only do so much. The citizens have to be responsible.
The individual responsibility also comes forth. Also, sir, we were showing some graphs on the screen. We understand your study also involves studying the way the numbers have spiked in different states, particularly concerning the spread of the Tablighi Jamaat members. You're looking at Delhi, Tamil Nadu, Uttar Pradesh, Maharashtra and Rajasthan. If you could refer to that study and help us understand in brief, how have the numbers sort of spiked in these individual states? To what extent the local efforts by the administration helped in containing the numbers? If you could follow the order, we'll show the graphs on the screen as well.
Now, if you can see, if you can simply draw a parallel between Maharashtra or Tamil Nadu versus Rajasthan, I believe in a simplistic manner, Rajasthan has done reasonably well in terms of containing some of these cases. You can also see that there is nearly a threefold increase post this event. If we were to use that particular event as a benchmark and then compare the cases before and after. Now, if one were to draw parallels between all states per se, there is also a great deal of variance in the death rates. There is also a great deal of variance amongst the people who have recovered. Now, again, sometimes where we project certain things to be our weakness, that actually becomes our strength. It has not been understood even now that why there is so much variance. And one of the reasons for this variance is that there is also, while certain community, certain events have taken place which have resulted in spike, but then there are others where people have at the community level. There are, various Mahasabhas where there are various communities, caste-based, religion-based, which have really come forward and have been contributing to not only to the sighting of these people, but getting them admitted and then thereby getting them timely help and coming out of recovery. Because if you take three variables, number of police persons per 1,000, a number of hospitals per 1,000 of population, and community outreach efforts as three variables only, because there could be a number of variables. The community outreach variable actually has much more efficacy, because at the community level, if you're able to sensitize people, if you're able to tell people that this is a global pandemic, this is a very serious situation, and people must identify themselves, report themselves, they must self-quarantine themselves, and they must take appropriate. This is going to be the way of life. And
so there have been many estimates about, and these are estimates about the kind of impact that this Tablighi Jamaat congregation, the responsibility in causing the spike could eventually result in a particular set of numbers. Does our analysis look at a possible figure that this Jamaat congregation could have cost in the future? The
number that our model predicts is that by 14th of April, the number should be around 13,000 cases. That number could have been maybe less than half of that number but now I believe if the government acts and people cooperate and people are able to do contact tracing and people are able to self-quarantine, treat these people, get them
admitted to the
hospital.
And you mentioned people. It's very important for people to come forward. I mean, you mentioned there's as much
it's a community responsibility.
It's an individual responsibility, you emphasize again.
It's individual as well as the community within which people are there. So if you're living in a colony, in a mohalla, in a particular particular area, a sector, the people in that sector, mohalla, colony, ultimately will have to take cognizance. In villages, for instance, I think some of the panchayats will end up playing an incredible role in bringing forward some of these situations.
Also, the new steps that have been taken by the administration, sir, if I could bring that aspect in, hotspots in different states have been sealed. So it's like a lockdown within a lockdown. Yes. How significant are these very stringent measures to again contain?
I think if we were to go by our model prediction, I do not wish to give a number, as we'd mentioned. If we go by our model prediction, these numbers could be really alarming numbers by the middle of May. However, we as a nation have taken one of the most important steps, and that's a lockdown. And now we have identified hotspots. Now, if you maintain the hotspots and have a near curfew-like situation in hotspots, and you maintain a lockdown, we would be in a much better position than otherwise. People must realize that there is at present no cure, no vaccine. So our protection lies with the way we conduct ourselves. And therefore, lockdown, self quarantine, people taking all precautions, and in the hotspots where the possibility of a contact is very high, you have to have near curfew-like situation. If you'll indulge me, in a place like Dharavi, for instance, Mumbai, it's about 580 acres of a particular piece of land in the center of Mumbai. Do you realize that the estimated number of people who live in that 580 acres is about 7.5 lakhs? Now, if you do not really strongly enforce self-quarantine and social distance, it is going to be virtually impossible for avoiding the spread of this disease. And therefore, the hotspots is an excellent step that the government has taken. Identification of hotspots. They have to be a near curfew-like situation there. And I believe that we really need to maintain a lockdown situation, barring, I think, agriculture labor, where relaxation, and I think that farm labor should remain contained to farms. And migrant labor, I think the factories and the companies who they were working for could be accountable to keeping them where they are. And government is already supporting, financial incentives are there for them to be taken care of.
And right, so and finally coming back to your paper, you mentioned how hotspots, sealing of the hotspots, quarantine are the measures required at the moment. But the paper, the manner in which it focuses on the analysis of pre and post Tablighi Jamaat congregation, any key takeaways that the administration could use from your research that could be applied to contain and to tackle the challenge of COVID-19?
Let us imagine that we have a vaccine in a week or 2 weeks or 3 weeks or 4 weeks. Let us imagine a hypothetical scenario. You still must ensure that any places of congregation should not be permitted, and they must be closed at least for reasonable duration in the future, because any place, it could be even large schools, bus stops.
It's like a lesson for the future.
It is lesson for the future. I think near future we cannot have places where there are large-scale congregations, and I think government really needs to identify those places and close them down. So I think that's the biggest
takeaway there. Professor Dheeraj Sharma, thanks very much for joining us in the studio and sharing us insights from your paper.